think that we are approaching 300 people watching right now, and we are a couple of minutes, a few minutes late. I apologize. This was a problem that I had in my own personal connection, coming late a couple of minutes. It happens to everyone with technology sometimes. Good morning, and I welcome, and I want to thank you all for participating and having a discussion this morning about what the plans are and how, more importantly, how they will be implemented for the full semester of this year. But before we go there, I would like just to spend a couple of minutes to reflect back on the year that we had, which was, without any doubt in my mind, the most difficult year in the history of this university, because we had to change our operations so much. We had to deal with a lot of challenges in our professional and personal lives, and with a lot of uncertainty, especially all of us who are here today, that we have responsibility in our leadership roles, and we lead people during this period. And yet, at the same time, in a very strange way, this was one of the most successful years that this university ever had, with all metrics. So I'm very proud of what our community has done. I'm very proud of the progress that we have made and the fact that we managed to continue to advance our mission in all of its components: learning and teaching, taking care of patients, research, community engagement, despite the very difficult conditions that we faced. I'm very proud of the way that our community reacted. Everybody who was on campus followed directions, was in compliance with the measures that we took, which made this campus a very safe place during the last year. And I know that all of us owe it a lot to the directors, to the department chair, to the assistant chair, to the associate deans, to the assistant deans, to the deans, to everybody that had this responsibility. And this is the group that is here today. I worry about you. A lot of people worry about fatigue. I worry about fatigue of the administrative structure of the university, and I worry about the stress that you have endured. I wish that I had good news to tell you, oh, this is over now, and we are 100% back to normal. If we learned anything during the last 19 months, was the need to be flexible, the need to expect the unexpected, and unfortunately, this is where we still are right now. But there is light. This is a transition semester for all of us, which makes it difficult. I understand it, but at least we are moving in the right direction. And we are here today with the entire group of vice chancellors and our chief medical expert in the field, Dr. Bleasdale, to answer questions, to give as much direction as it's possible for moving forward this fall, and to hear your opinions and your concerns as well. I want to thank you for a number of questions that they have been submitted by now. All of them are very reasonable questions and very practical questions that they are coming up. I think, as you will hear from the different vice chancellors and from Dr. Bleasdale in the next few minutes, they will try to answer most of these questions in the comments that they will make. There are some that we know that will not be answered, and we will deal with them as soon as the first round goes by. And then I encourage you, continue to submit questions. I will try to moderate, and I will try to read them and see where am I going to pass to. And let's get started, because there is a lot that needs to be said. The only other thing that I would like to highlight at this point is that we need to remember that our primary mission here is to serve and support our students. This is driving a lot of the things that we do. We want to make sure that our students continue to make progress. And it's a challenging environment that we will have this fall, because we will have a new class first-year students that they have been away from classes for quite some time, and they need to catch up. This is what's driving a lot of the decisions that we are making, is the mission and focusing on the mission that we have. So that's what you will hear, and how we have tried, and the measures that we are taking to make sure that this continues to be a very safe environment as we go through this fall. And again, please remember that we need to have flexibility, and what we're talking about today is valid today. 3 weeks from now, 4 weeks from now, we may have a different type of discussion, but that's unfortunately, I hate uncertainty as much as everybody else, but that's unfortunately the reality that we are in. I think we're going to start with Dr. Blisdale, if I'm not wrong, to give us, an expert perspective of where are we right now and what needs to be done. And then Susan, you will pass it to the next Vice Chancellor and so on. So thank you.
Thank you, Chancellor. So I think just so everyone's aware, what's the current status of COVID-19 right now? And many of you know that there's an increase in the number of cases in Chicago and throughout Illinois, and of course across the country. We have increased positivity in the city of about 4.5% now for our testing, when we had been down in the ones earlier this summer. This is primarily related to the Delta variant. This is a version of the strain that is much easier to transmit, and this is what's causing increased positivity in our area. Within our hospital, we have 17 patients in the hospital right now and 7 within the ICU that are infected with COVID. We have seen some cases in those that are vaccinated, but overall, this is very mild. These cases in those that are vaccinated have really been because people have been following the precautions. They've gotten vaccinated for this additional protection. And what was previously suggested is that you could unmask with some activities. And really what we've seen is that you can still acquire the infection even though you're vaccinated, but your risk is lower. But you also can transmit it. And so this is why the CDC in July recommended to resume masking, even if you're vaccinated. And that's why it's been so important for us to continue being masked on the campus throughout to help to prevent transmission to those that are vulnerable, even though we are vaccinated. So again, it's really important for all of us that are doing what we need to do by protecting ourselves with vaccination to make sure that we're still wearing our masks. It's also important that if you've been vaccinated, for everyone to be aware, if you have any signs or symptoms of COVID-19, that you need to get tested, even if you're vaccinated. And so we can identify and make sure that those individuals are isolated. Again, this is primarily related to the transmission of the Delta variant, which is easier to spread. Over the last year and a half, as the Chancellor has highlighted, we've been able to do many in-person activities before this point as we're entering the fall semester. And that has been through a lot of work of many on this call and others in support as well. We've been able to have in-person activities because of our masking practices. Masks are very effective in preventing the transmission of COVID-19 because of our testing regimens and our contact tracing teams that have allowed us to very rapidly identify cases and prevent transmission on the campus. And really, in the past year and a half, we did not see any transmission within the classroom settings, which is very reassuring. We've also seen that across the country, as there had been other schools that had in-person activity, and we can see that masking is very effective in preventing transmission of the infection. And as we begin this fall with the requirement for vaccination to help to protect our students, our faculty, our staff, our visitors, most of us on campus will be vaccinating. And so I think that's important because this is allowing us to move to more in-person instruction. And then we are continuing to focus on distancing in the settings of higher risk of transmission. In particular, the highest risk times, even for those that are vaccinated, are these times when you take your mask down. So these are events, eating areas, break times. It's really important that we're wearing our masks to prevent any transmission. Many have heard about boosting of the vaccine. We are waiting on further guidance on whether or not those that are vaccinated will require a booster. And right now there is approval for a booster or a third dose of vaccine for those that are immune compromised. And we have that available at UI Health. I think for those that have not gotten vaccinated yet, we have vaccine available through UI Health on our campus. And the vaccine is free. It's free for our patients and for our campus community at large. And if anyone needs to get details around how to get vaccinated, we have information at vaccine.uihealth.care, or of course you can look at also vaccines.gov for resources to get vaccines where you need. With the requirement of vaccination, there are many questions around which vaccine will be accepted. Of course, the currently emergency use authorization approved vaccines in the United States are the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine, also called the Janssen vaccine. All three of those are acceptable vaccinations. For those that were vaccinated outside of the United States, there is a list of WHO approved vaccines as well, and that continues to get updated as those have been reviewed and have emergency approval for acceptance. So UIC will accept WHO approved vaccines as well. There's lots of questions also on those that have had COVID-19 in the past. Do they still need to be vaccinated? And yes, because we have data that those individuals that have been infected with the infection before do not have the same level of protection as those that have been vaccinated. So this definitely is an additional layer of protection for those that have had past infection. So those that have been infected, it is important that you also are vaccinated as well. Again, as I highlighted, that there are some times where you can acquire the infection. The risk of acquiring the infection is somewhere around 8 times less in those that are vaccinated compared to those that are unvaccinated. And the risk of death and hospitalization is up to potentially 25 times less in those that are vaccinated from those that are unvaccinated. So really, again, important to make sure that you're vaccinated. And that is why it's been so important for our faculty and our students and our staff to be vaccinated on the campus. There's many questions around what are we doing to help those that have questions about being vaccinated and maybe have some hesitancy. We have been working through multiple channels, social media, student campaigns, targeted outreach to certain areas, multiple town halls. We have frequently asked questions that are posted on our UI Health website, our vaccine website, and then also on our UIC General Campus FAQs as well. We also have our contact tracing team that was calling out to those that either had not completed their vaccination series or had not taken the opportunity to be vaccinated to make sure that they had information they needed to be able to get vaccinated. The other question we've had is, after vaccination, do you need to continue to wear masks? And that's still really important for all of us to wear masks while we are indoors in all settings on the campus. And this is because, again, the vaccine is very protective against hospitalization and death and decreases your risk. But we have seen some cases when people that are vaccinated, that are unmasked, have acquired the infection. And so it's really important that we continue to masks in all settings. And many may have seen that the city has also announced a mandate as of this morning on top of their recommendation that came forth with the CDC's recommendation at the end of July. We have continued to require it in all of our campus buildings, and so this will continue moving forward. Outdoors, masks right now continue to be optional, where the risk of COVID-19 in the outdoor setting is lower than indoors. But it's really important for those that are vaccinated, you really don't need to mask. Outdoors, for those that are unvaccinated, they need to continue to keep that distance. And when we have a large gathering of more than 25 people, you might consider wearing your mask, or where you cannot keep your distance and there might be an opportunity. We'll continue to evaluate that in the outdoor setting as the year goes on. I think there's another question that we've had is, what will be some of the deciding factors around the teaching mode and distancing? Right now, we are using social distancing whenever feasible, especially for these unmasked activities, like I highlighted, eating, social events, break areas. These are the opportunities where distance, when you are unmasked, is critical, even if you are vaccinated. But again, with the vaccine requirement and with universal masking, we can use distance as needed as an additional measure in these high-risk settings. We, again, had not seen transmission in classes. We will continue to evaluate that, and should we see any signs of transmissions in the campus or in the classes, we may need to pivot in some sense. And of course, we will follow the guidance of the Department of Public Health. I think the other thing to make people aware of from the circumstances, because of the ongoing transmission across the United States, there is new travel restrictions that are currently in place. The entire United States went to yellow, where you didn't need to follow really any precautions regardless of your vaccination status. But now many of the states across the US have become orange again, with high levels of ongoing transmission of COVID-19. And so what's required right now is, so it's important for anyone that is traveling or returning from personal or university-sponsored travel that's coming from an orange state, that they make sure to check in with contact tracing for guidance. So those that are vaccinated do not need to quarantine, but they do need to test upon return. And so that's an important change that happened as well. Not a change from our practice, but a change from what had been stated from CDC previously. And of course, international travel does need to be evaluated on return as well. Contact tracing, I think it's important for people to understand contact tracing and quarantine. For anyone that is positive, that has an active infection with COVID-19, they will be required to isolate, and that's isolation until they are out of the infectious period. It is anywhere from 10 to 20 days, depending on their severity of illness. Quarantine is when you've been exposed to the virus. And so for those that are vaccinated right now, you are not required, again, fully vaccinated, are not required to quarantine, but need to make sure that you're masking in public settings. And we do need you to notify us if you have had an exposure so that we can provide that guidance to you around that masking as well, and that testing requirement in addition. For those that are unvaccinated, they are required to quarantine and test. To help make sure that you are aware of this guidance, there is on the UIC Today a site where you can upload if you've been tested outside or if you had an exposure, so that you can be contacted by the contact tracing team. The other thing around contact tracing is really, as we are starting this fall semester, there's likely, because of the increased transmission, that there will be positive cases. So it's important to make sure to facilitate and encourage students, staff, and faculty to be cooperative with the contact tracing team, to make sure that they're aware of when you have a positive result or an exposure. Also, be aware of your surroundings, who you were around, so that we can quickly identify those that have a true contact or exposure, to facilitate quick contact tracing and testing. The contact tracing team also provides symptom monitoring, guidance in your personal and home setting as well. And then, of course, quarantine for those that are not vaccinated or unable to be vaccinated. So it's important, again, to cooperate with the contact tracing team and to help to facilitate that, that investigation. And so I think that those are my kind of answers to some of the questions that we've had so far. And I think right now, then I will turn it over to Vice Chancellor Augustine next.
Thank you very much, Dr. Bleasdale. I appreciate that. And thank you all for being here. I want to cover three topics in my remarks here. The first one I'm going to talk a little bit about is vaccination data and some of the systems we're using to collect that data and work with it. So first thing I want to make very clear to everyone is that we are requesting everyone disclose their vaccination status no later than Monday, August 23rd via UIC Health Check, whether they be students, faculty, or staff. It's really critically important we have that data so that we can appropriately plan for the fall semester. We've also instituted updates to the UIC Health Check app to improve its clarity and the quality of our data. Now everyone will need to respond with one of four options in the Health Check app: that the individual is vaccinated, that they will be applying for an exemption, whether religious or medical, that they are approved by their unit to be fully remote and will not be coming to campus, or that they have no intent to vaccinate. Vaccinated individuals will also now have a permanently green badge that displays the word cleared instead of exempt. We've made that change to avoid confusion now that we have vaccination exemptions in place. We also have some preliminary data on vaccination rates that I'd like to share with all of you this morning. 67% of our students are vaccinated, and that number over the last 10 days has been increasing, an increase of about 20% just in the last 10 days. 74% of our faculty and staff have been vaccinated, and that number has gone up about 10% in the last 10 days. In terms of exemptions, we have 541 student exemptions and 113 faculty and staff exemptions. We've had some questions about how we've let an individual know that their exemption has been received. You should all be aware that an auto response is sent very shortly after an exemption is submitted, acknowledging that submission and letting the individual know that they now need to regularly saliva test and do health check when they are on campus. If there's a problem with the exemption as it is reviewed, student health services or university health services will follow up appropriately, either with students, faculty, or staff. We'll be making this information available publicly on the COVID dashboard after the first or second week of the semester, once we have more reliable data and we get closer to the census date on campus. One point I want to make clear is that students who are not vaccinated do not have an exemption on file should not be coming to campus. And the number of students with exemptions is relatively small, just 1 in about every 50 vaccinated students. So in other words, we should have very few unvaccinated students on campus. We will be using swipe card access and connection to campus Wi-Fi to track this. So individuals who swipe into a building or connect to campus Wi-Fi will be identified and linked to data that includes vaccination status or testing status as appropriate. And that information will be provided for employees to their supervisors and for students to their colleges and dean of students. I want to reiterate, last thing on vaccinations, that we need these disclosures by August 23rd. Auto reminders are going out to everyone who is not disclosed at this point, but I encourage all of you to remind your employees and work to remind students as well of this in the coming days. Second topic I want to talk about is testing. Right now, the campus has a capacity for saliva testing of about 3,000 tests per day, and we're going to be using that capacity in a number of ways. Individuals who have not been vaccinated for any reason must test twice per week now if they are coming to campus. That requirement will begin again on August 23rd. Our hours for testing have returned to their regular business hours that we had during the last academic year, and we will adjust those hours if needed in the future. We will also begin surveillance testing of individuals who are vaccinated on sort of a rotating basis. More information will be coming about this in the first weeks of the semester, but we will be starting this process with students who are living in campus housing, who will all be tested as they arrive on campus, regardless of vaccination status. This will help our contact tracing team gain better data about how the virus may be spreading amongst vaccinated individuals. Cohorts may be identified for targeted testing later in the semester if the contact tracing team finds that there are groups of individuals who require that. We did that multiple times last year in various parts of campus, and it's relatively simple to implement, and we will do so again as needed. The last topic I want to talk about is support for technology in our classrooms. You all may remember last spring, we committed to have streaming or recording capability for all classes this fall, and we've invested about $5 million in rolling out that project. Virtually every centrally managed common use classroom on East Campus has been fully upgraded at this point to state-of-the-art technology. In our college rooms, we can guarantee at this point that all these rooms will be able to stream or record using either existing equipment or portable equipment that will be made available as needed. The ultimate upgrades to state-of-the-art recording and streaming technology in these college rooms on East and West Campus will be ongoing. We would have liked many of these improvements to be in place at the start of the semester, but a handful of issues ranging from equipment availability, contractor availability, and our staff's size has slowed the project more than we would have hoped. Again, that said, we will be able to record at a minimum all classes this fall. And over the course of this fall and winter break, we will have all of the technology implemented. And that will allow us here at UIC to have really, truly state-of-the-art technology to support our teaching going forward. We've also been working this summer to roll out training programs that have been available to faculty to help them understand how to take the most advantage of these new technologies. We've also hired a significant number of students who are prepared to work with faculty as they need support this fall. That brings me to the end of my comments, and from there, I'll turn it over to Vice Chancellor Coronado. Yep. You're muted, John.
Great. Thank you, TJ. Good morning, everyone. Let me start by saying that we've been working really hard to create and maintain safe spaces throughout the university. And these plans and actions that we've taken address building ventilation and potable water systems, the cleaning and sanitization standards, placement of signage, hand sanitizer, disinfectant wipes, spacing and configuration protocols, ready to implement if we need to reduce density. So I'll go a little more in depth on each of these items. First off, with respect to ventilation assessments and some of the questions asked about that previously. Yesterday, I released a DDDH email that summarized our ventilation assessment, and I'm happy to report that the vast majority of our spaces have adequate ventilation. In all buildings, we were able to significantly increase both the amount of fresh air introduced into each building, as well as the overall ventilation rate. This means that all buildings have improved air exchange rates. We were also able to improve the level of air filtration in many buildings, and we tested over 4,200 individual rooms to confirm that our procedures yielded positive results. Overall, there's still about 60 rooms across 20 buildings that will get additional air quality monitoring by our Environmental Health and Safety Office over the next month to determine whether HEPA units are required in those spaces. But I anticipate that we will have few, if any, HEPA filtration units in place after these assessments are completed. With respect to water testing, in addition to performing the ventilation assessments, our engineers have also been exercising our potable water systems in all our buildings so that we don't get stagnant or standing water. They've been turning on faucets, flushing toilets, operating drinking fountains, and things like that. And we've also done some Legionella testing in the higher risk areas to make sure that we don't have Legionella growth. And we've gotten back good results on all those tests. There have been lots of questions about building access. And there was a DDDH email released on August 12th that described what we're doing with respect to building access. The email also provided a link which lists the type of access and operating hours for all campus buildings. It's important to know that we worked with the classroom scheduling office and all the colleges and departments to determine what would be the best access schedule for each respective building. In general, most of these campus buildings will be open and unlocked during normal business hours. And on the West Campus, the access will vary from being open and unlocked or on unrestricted card access status during a building's designated building hours. In most cases, during normal hours, if a building is locked, anyone with a valid I-card will be able to gain access to the building. Let me spend a minute talking about the classrooms and administrative spacing and configurations. As Dr. Blaisdell mentioned, we'll start the semester with no minimum spacing distancing requirements for classrooms and administrative areas. However, we do encourage all to continue distancing where feasible, especially in the higher risk settings, such as areas where there might be eating and drinking. We also recommend encouraging additional distancing in those workspaces or classrooms that have the available space to distance. It's worth noting that many larger classrooms still have the sit here stickers in place, but all seats are going to be available for use. Also, in elevators and lobby areas, stairwells and restrooms, there is still signage that encourage and reinforce the health and safety practices. However, the distancing signage in those spaces and throughout all our buildings are not applicable at this time. And we're going to put additional signage at the entrances of all our buildings to reflect that. And the reason why we kept the signage in place is in case there is a need to pivot to the indoor distancing requirement, in which case we'll deal with that should that come to effect. Also, disinfectant wipes should be readily available for faculty and students to use for their seating and work areas, and hand sanitizer will be available at building entrances, elevator lobbies, and for classrooms with seating of more than 50 students. Now touching base on some cleaning standards. Our building service workers will continue cleaning all the spaces that they have been cleaning in the past. This includes every classroom on campus. They will disinfect frequently touched surfaces multiple times per day and provide daily cleaning of all classrooms. We've added additional late night work shift to assist with all these daily cleaning requirements. And our building service workers will also weekly deep clean and sanitize classrooms, restrooms, and elevators using an electrostatic spraying process with hospital-grade disinfectant. This deep cleaning capability will also be employed in any space where there may be a COVID-19 exposure. Additional cleaning responsibilities for faculty, staff, and students include some shared workspaces, collaboration spaces, break rooms, kitchenettes, coffee stations that aren't really serviced by our building service workers. And for those spaces, there should also be cleaning supplies, wipes, and hand sanitizers that are readily available so that these areas can be maintained. Touching briefly on transportation, much of what I discussed in terms of cleaning and sanitization also applies to our transportation services, which is our night ride, our paratransit, and our buses. It's important to note that face masks are required when utilizing these transportation methods. Now I'd like to talk a little bit about the visitor and event guidance. I plan to release a DDGH email message later this week that will provide both websites, which many of you may be familiar with already, to provide websites to both of our visitor and event guidance. And these will also be linked on our COVID-19 website as well. These requirements are established to maintain the public health and safety of our community. So we define visitors as individuals who come to our campus to conduct business, participate in meetings, events, or community engagements, or otherwise come to campus at the request of a UIC staff or student. Frequent visitors are defined as individuals who are required to be on campus an average of 1 of 5 days a week to conduct university business or engage with UIC employees or students in campus spaces other than the hospital or clinics. And departments, where we're making this a requirement for departments to sponsor these frequent visitors as an external affiliate and obtain a visitor ID card for them. And this affiliation will allow these frequent visitors to get an iCard and also enable them to disclose their vaccination status or participate in the health check and saliva testing at one of our testing locations. This is an increased measure of safety that we want to implement so that everyone is coming to campus is operating under the same situations. An event, with respect to events, this is defined as any in-person university-sponsored extracurricular activity, either on or off campus, that brings together individuals outside of their primary job responsibilities or duties. And one of the key event requirements is that all events must be registered, and any event with over 100 attendees or any event that requests deviations from the established guidelines must submit a safety plan for review and approval by our environmental health and safety team in advance of the event. Another requirement, there's other requirements stipulated in there for masking, for vaccination status, for eating and drinking and things like that. So I urge those that sponsor visitors or plan it or to host events or to frequently visit these established websites to see the current guidance, because each site has detailed guidance and it's routinely updated based on the most current public health guidance informed by the level of community transmission and other factors. I'll close by saying that I'm confident that our spaces are as safe or safer than most other spaces in the Chicagoland area. We have numerous layers of safety incorporated, and we're ready to respond to any potential source of contamination. And I'm looking forward to a great semester. With that, I'll thank you, and I'll turn it over to Provost for some comments.
Thank you, John, and thank you everyone for attending today's conversation. I'm Javier Reyes. I'm the incoming provost here at UIC. Some of you may have not seen me before. You have been working with Karen Crowley a lot, and she will continue to work with us even today. She has been working with me to develop a lot of the guidelines for faculty, for staff. Given her familiarity with the campus, given her familiarity with all of you, we decided that it would be good for her to be the one that presents those guidelines to you and goes over them. But I've been working with her. I'm being briefed by the leadership group on all the different aspects and changes that we have done on campus to keep a safe environment for all of us and really complete our academic mission. So with that said, I'll get out of the way so that Karen can talk about this. But we'll be working with all of you in the coming days and weeks as the COVID-19 pandemic continues to evolve. And I just want to say quickly that I want to thank you in advance for your compassion for our students, the compassion for our staff, the compassion for your colleagues, and for working together as we try to adapt to what is a very fluid environment, and that it will require your patience, it will require your stamina, and it will require your focus and commitment to our academic mission. So thank you in advance for that, and thank you for your patience with us as we continue to navigate this fluid environment. So Karen.
Thanks, Javier. So hi, everyone. Today I'm going to summarize the academic guidance for instructors and students that's posted on the Provost website, and that will be referred to in an upcoming campus communication. Please be aware that we will be editing these guidelines as new information comes in, and in fact, we already have some additions ready to go. I want to start by highlighting again that it's important to keep in mind that this is a transition semester, and our focus should be on helping all students move forward with their program of study if possible. And just to repeat some of the things you've already heard that are also found in the guidance, everyone must wear masks in the classroom and other public spaces. At one point, we were hoping, when the infection rates were looking very good, that instructors and students doing oral presentations might be able to remove their masks. However, at this point, with the Delta variant surging and the fact that vaccinated individuals can be infected and infect others, and on the advice of our medical experts, we would like everyone to stay masked. Hopefully, things will clear up and we'll go back to the original plan. At this point, in the classrooms, we will not mandate the 6 feet of social distancing, but we encourage social distancing, and instructors are definitely asked to allow students to socially distance if they want to and if it's feasible. Please also encourage faculty, staff, and students not to come to campus if they have COVID symptoms. And as most of you know, a list of these symptoms can be found on the Daily Health Check app. Students have been guided to attend on-campus and hybrid classes in person if they are vaccinated, if they have an approved medical or religious vaccination exemption and are doing their twice weekly saliva testing and daily health check, or if they have received 1 dose of the COVID vaccine and have a second scheduled and are doing their twice weekly saliva testing and daily health check. Not all students will come to campus, and those who are unvaccinated with no exemption should not come to campus. We ask instructors to find ways to provide course content to students who cannot come to campus. This could be through live streaming or video recording or other mechanisms. For example, providing copies of slides and suggested readings. However, we realize that virtual attendance would be impossible for some courses, like labs and clinical rotations, and students who are not coming to campus will not be able to complete these classes successfully. We also realize that live streaming and video recording might be difficult for courses using active learning approaches like small group discussions. And there may be situations where providing course content is difficult. Students who cannot come to campus have been guided to immediately check with their instructors to determine whether it's feasible for them to attend courses virtually. We ask instructors to make very clear in their syllabi what requirements for their classes are in terms of in-person attendance, in-person examinations, and whether course content will be made available to those students who cannot come to campus. So what is expected of instructors in the classroom with respect to monitoring student compliance? Instructors are not expected to monitor vaccination status, vaccine exemption status, or testing status. The campus will do that. And those students out of compliance will be reported to the Dean of Students and subject to the student disciplinary process. Instructors are expected to monitor student mask wearing. Students should be wearing tight-fitting masks that cover their nose and mouth at all times. If a student comes to class without a mask, please send them to the student centers where we will be providing masks at the center information desks, at least for the first weeks of class. After that, they need to bring their own masks. Also, please be aware, as I'm sure many of you are, that departments have been provided the opportunity to acquire additional masks for faculty, staff, and students. If a student refuses to wear a mask, the instructor should ask them to leave the class. After class, the instructor should file a report to the Dean of Students using the COVID-19 noncompliance report. And there's a link to that report on the guidance webpage. If a student refuses to wear a mask and refuses to leave the classroom, the instructor should call the Dean of Students for guidance. And they also might consider dismissing the class for the day if this situation becomes disruptive. They also should file a student misconduct incident report with the Dean of Students. Again, there's a link to that in our guidance. We do not encourage calling the UIC police unless it is an emergency situation where a student is threatening violence. Any students who are reported to the Dean of Students office will be subject to the student disciplinary process. And again, we have linked that on the guidance. I also want to let you know that links to the student and instructor guidance posted on the Provost website, as well as the guidelines for responding to student behavior from the Dean of Students website, can be found on the University Blackboard site for easy reference. On a more positive note, the guidance for instructors also includes how to obtain training in the new technologies found in the classrooms via a variety of CATE offerings. This can be done in person by request or virtually using a series of videos. You can look at our guidance for more information. Also described in the guidelines is the on-the-ground tech support that CATE will be providing to instructors and that TJ mentioned before. But I'll give you a little bit more in detail. There are 3 levels of support. The in-classroom support involves 35 undergraduates who've been trained and will be deployed throughout the lecture centers to be on demand to support instructors who need help with AV equipment and streaming or recording technologies. Tier 1 support can be summoned if the in-classroom support cannot resolve an instructor's problem. The Tier 1 support team can help with broken equipment or system failures. And phone numbers for Tier 1 support are found on monitors and or touchscreens in the classroom. And finally, Tier 2 support team members are IT experts that can solve more complex issues and can be called by the Tier 1 team when needed. So I'll stop here and I will turn it over to Vice Chancellor Ginsburg.
Before we go to Mike, let me highlight one point that Karen made. And this has to do with a student that comes into class and either doesn't wear a mask or disrupts the class in any way. Let me underline what Karen said, because that's important. Right? We want to make sure that if there is a situation like this, the faculty member de-escalates the incident and does not escalate it further. Right? By calling the police or by picking up a fight with the student, this is an escalation, and that is not going to lead anywhere. So I think that after a couple of calls to the student to leave the class, get a mask if they're not wearing one, or if they're not wearing it correctly, put the mask on. At that point, I think it's much better to dismiss the class one day and let the disciplinary process deal with the student, instead of trying to resolve the issue at that point, because it will not be resolved. So that's the message, is try to de-escalate situations like this, not escalating, and then we'll deal disciplinary with this, way with these students, with people who know how to handle this situation much better. Michael is going to talk now about more disciplinary, what we do with other people that we want to apply.
Good morning, everyone. So you'll recall that a few weeks ago, the University of Illinois system sent out a communication indicating that we are going to require all employees, faculty, and staff to be fully vaccinated for fall 2021 semester unless they apply for and are approved for a medical or religious exemption. The goal of the policy is to encourage vaccination among all the members of the university community, and in doing so, protect our employees, students, families, and our community from contracting and spreading COVID-19. All employees and non-employees who are frequent visitors to the campus, which will include vendors, volunteers, and contractors who are able to receive a COVID-19 vaccination unless they get a medical or health exemption, must be fully vaccinated with an FDA or WHO authorized vaccine and submit documentation confirming such vaccination. UI Health and the hospital will have a separate COVID-19 vaccination policy for its employees containing similar, but in some instances differing requirements. UIC employees who also work at the hospital will be required to comply with the requirements of both policies. Employees who have been approved by their unit head or college dean to work remotely should also comply with the requirement to be vaccinated. However, those who are unvaccinated and come to campus for any reason must secure a negative COVID test prior to arrival. Medical exemptions may be granted to an individual whose physician documents a diagnosis of one of the conditions the CDC considers to be a contraindication of the COVID-19 vaccination. Those contraindications include a severe allergic reaction after a previous dose or to a component of the COVID-19 vaccine, an immediate allergic reaction of any severity to a previous dose, or a known diagnosed allergy to any component of the vaccine. And please keep in mind that the CDC recommends that individuals with most pre-existing conditions receive the vaccine to protect their health and safety. Religious exemptions based on sincerely held religious beliefs, practices, or observances may be requested online within the UIC Health Check application. UIC will work with individual employees who have an approved medical or religious exemption to develop a plan to continue to meet their work responsibilities. We've received many questions regarding the consequences for non-compliance. Enforcement of the COVID vaccination policy is the responsibility of each unit, college, or school. Enforcement should follow progressive discipline requirements as outlined for employee classifications through existing policies and/or union contracts. If an employee has not completed their vaccination disclosure or received an exemption by August 23rd, here are the steps that should be utilized. The supervisor, unit head, or unit HR officer should provide the employee with an initial verbal and/or email warning. If vaccination or exemption approval has not occurred by September 15th, the employee should receive a second and final reminder to comply, informing the employee that they are not in compliance with the UIC COVID vaccination policy and that failure to comply may subject the employee to further progressive discipline in accordance with the employee's applicable collective bargaining agreement, civil service statute and rules, and university policies, whichever or in combination applies. The UIC website has links to all of the applicable collective bargaining agreements which are provided in the policy. Civil service employees have a prescribed disciplinary process up to and including dismissal, which includes verbal counseling warning and letters of warning, disciplinary suspension, and discharge procedures. Faculty who are covered by union contracts have an outlined disciplinary and dismissal process in Article 15 of both the tenure track and non-tenure track union contracts. And academic employees, while they do not have a prescribed procedure, may be issued written and verbal notices as an initial progressive disciplinary step. And if those steps do not lead to timely compliance, as a last resort, may be issued a notice of non-reappointment. As a reminder, the UIC remote policy, which we announced in May, is still in effect. If operational needs allow for a vaccinated or unvaccinated employee to work remotely, supervisors can approve remote work assignments for a period of time or on a hybrid basis. However, remote work does not disqualify employees from complying with the vaccination policy. Employees are given an option in the health check application, as TJ mentioned, to indicate that they're working remotely, but must be approved to do so by their department. And in fact, we want you to review your health check reports to assure that any employee who has indicated that they are 100% remote has been approved to work remotely and to indicate their vaccination status in health check. Finally, Supervisors may have a conversation with unvaccinated employees regarding their vaccination status, however, cannot probe and ask an employee for the reason that they've been chosen to be unvaccinated. That discussion should focus on the university requirement, which allows for only two options: disclosure of vaccination details or exemption for medical or religious reasons. Supervisors who have questions regarding the progressive disciplinary policies or procedures for union employees can reach out to UICHR's Labor and Employee Relations staff for guidance. And if you have any questions involving academic professional employees, those questions can be directed to me. Thank you, and I can follow up on any questions that we're unable to address in the town hall meeting today.
All right. Thank you, Michael. Now comes the more challenging part for me is I'm watching the Q&A. I've seen what questions have come in, and we have a couple of people also that they're trying to help and send them to me. So we'll try to answer as many of these questions as possible. And let me start with the clarification on one of the questions. I think the question of what do we do with unvaccinated students in terms of the academic component, do we try to facilitate them and so on, has already been answered by Provost Reyes and Dean Foley. But let me also point out, because the question, the way that it was phrased, is that we have 33% unvaccinated students that they may be coming to campus, or they may be taking the courses that they are offered on campus. That's not a correct statement. At this point, we have 33% of students who have not responded to the request that we had to disclose vaccination status. And now we have changed the site to be able to say that I'm not coming because I'm doing remotely. We know from the registrar's office that there are at least 15% of the students that they registered in only online courses. So we need to take this percentage out. And then we are going to have a search of student disclosures as we approach Monday. Because as many of you know, the students don't pay too much attention to us right now until the very end. So we'll have a much better picture of how many unvaccinated students that we have. And then if we subtract from them the students who are unvaccinated, but they are taking only online courses, I think the percentage is much, much smaller. Just as in information, this one doesn't change the essence of the question, where the question was, do we know about them, and what do we do about them, and do we need to make sure that they advance? And I think Karen answered this question. Let me go first back to John Coronado. John, there were a couple of questions, and I know you mentioned this, but let's clarify it again, because these are important issues. The first one is about the elevators, and how many people can be in the elevators, specifically in the UH, because there is a lot of traffic in these elevators anyway. And then the second question, can you please repeat the access to the buildings issues and approach that we are taking, especially in some of the buildings on the East Campus, where there are classes for undergraduates there, and how are we going to open it? And there was, this question was posted twice. Just one more time to make sure that everybody gets.
Sure. Thank you for those questions, Chancellor. So first, the first question with respect to elevators. So across the campus, you know, we put in concert with CDC guidance, we put signage in place that limited elevator occupancy to 4. However, since we're in a mostly or essentially fully vaccinated environment, and the distancing requirements have been removed, we now don't have any capacity limits in elevators or in general in other spaces. You know, the limits are dictated by the actual capacity limit of the given space. However, we did keep the signs in place in case we do need to pivot to a more restrictive environment. And those decals, you know, it takes a while to put all those decals in the over 200 elevators. And so for this semester, we chose to keep them in place. So again, no distancing required in those elevators. Elevators are typically short encounters. For instance, even the UH elevator where you got 15 floors, I actually timed this. If you stop on every floor, you're getting from the first floor to the top floor in less than 5 minutes. And we are fully masked in those elevators. However, if people want to be cautious and take stairs or wait for an emptier elevator car, of course, that's always a choice that an individual can make. Then the second question was respect to access. So especially on the East Campus, most academic buildings will be totally open during the normal business hours. We coordinated with the classroom scheduling office, as well as all the colleges, to determine what is the desired access for each building. For most of the general use classrooms and other East Campus classroom spaces, the preference was to leave them open during all classroom hours. So prior to classes starting, and then for a period of time after classrooms are starting, the buildings will be totally open. Many of the student services building as well will be generally open as well. There on the West Campus, there was a desire to keep some of the buildings as card swipe only. We call that unrestricted access, which means that anyone with a valid iCard can swipe in and get access to those buildings. And we leave it on to the colleges or departments to communicate it to their students and staff if there are special requirements, such as the unrestricted access to those spaces.
Right. Thank you, John. A few questions also, and most of them are technical questions to PJ about the. Let me start. Let me throw them one by one at you. First of all, there's a very simple question. I'm on sabbatical. What do I have to do?
Yeah.
Do you care if I'm vaccinated or not? And what do I have to do? I'm not planning to be on campus.
Right. So we do want everyone to fill out the health check form so we can have a full data set, which allows us to really understand the campus. So if you are vaccinated, you should click that you are vaccinated in the health check app. If you are not vaccinated, there are 3 options for you to check. One of them is that you are approved to be fully remote, which would be the case that you would click if you are going to be on sabbatical and you are not vaccinated. There's another to check if you will be applying for a health or religious exemption. And lastly, a third box that we hope is never checked really, but is that I will not be vaccinated. We want to get that because we want to have some understanding if there are individuals who are out there who have that response. So we do want everyone to.
The assumption is that the faculty on sabbatical will not be on campus, because if you're on sabbatical, right, and you're on campus, you follow the restrictions of the campus. It's not because you're on sabbatical.
Correct.
All right. There is a question also about tech services in Peoria and Rockford. Will we be able to
the upgrades? Yeah. So in determining this, I am glad that question was brought up. So in handling
and the other satellite campuses, right?
Yes, all of the
ones are smaller outposts. If anybody's listening, yes, Springfield and Urbana, the nursing sites, they're directly integrated into the 2 universities there. So it's a different story.
So I'm going to give you the quick answer. The quick answer is I can't right now answer exactly that question. What I can tell everyone is that we worked with all of the colleges on campus to understand what rooms that are managed by the colleges, which is over close to 400 rooms, needed to be upgraded. And so I don't have in front of me the list of all of those rooms. But again, we did work with the colleges of nursing and medicine and pharmacy, who I believe cover all of the regional campuses, to understand what new rooms needed to be upgraded. And so if the individual who's asking that question wants to follow up with me directly, I can get an answer. I'd also encourage you to follow up with your college level leadership because they will also have information on how they've deployed the resources that we've had in place.
And one last question. When and how am I going to get information about who is vaccinated in under, in my unit, right? Employees, faculty.
Yeah, so there is a system that's in place that provides this information. It's been in place since last fall. Right now, about 800 people on campus have access to it. I will start by saying if you feel that you need that access and you don't have it, you should follow up with your college or vice chancellor level leadership, speak to them, and they can get in touch with Sandeep Dath, who oversees the system and will provide you with access. So that's the first part. Secondly, this system is regularly updated as we have new information. So as new information is submitted regarding vaccinations or exemptions or what have you, we immediately update this. Now, it's not a push. We don't send an email saying, hey, your system's been updated, please check, but you will have access and you'll be able to look at what is basically a live report of the status of all the individuals in your unit. And just to be clear for everyone, since we updated the responses in Health Check, we've changed the format slightly to those reports to reflect those new set of responses.
Okay, great. Before I see the Q&A part is catching up, and there's a lot of interest. Before we start making assumptions all over the place, let's go into the social distancing principles and this tale. Let's talk about, because I see a lot of people that they're saying we have zero social distancing requirements right now. What are we requesting? Let's make this clear.
Well, I think that as we're having in-person classes, most of our classrooms have likely close to the 3-foot distance, which is the recommendation for the classroom setting. And in some circumstances, it is close to that 3-foot distance. I think overall, with a requirement for vaccination for the students and the faculty, the distancing requirement is less critical. The really key component in this is masking, and that the high risk activities are when your mask is down. And these are the areas with the highest precautions where we need to maintain that, that distance when your mask is down.
Speaking of masks, there's a set of questions. Do I have to mask in my office? If I'm alone, can I keep the door open? Or do I have to close the door? What happens if somebody, while I don't have the mask in my office, comes in a few minutes later? Am I putting these people at risk? They wear masks, I assume, coming into the office.
Right. So really the key is if you're alone in your office, you can unmask. And what we have from an information from the standpoint of the coronavirus right now is that it does not really appear to be staying suspended in air, and we have appropriate air handling in all of our locations. So it's really making sure that as you are talking and speaking with someone that you're wearing your mask, and that it does not appear to be suspended in air over time so that there's risk when someone comes into your space afterwards. So that's why it's not as critical to make sure the door is open or closed, but it's to make sure that you are at a distance, and that when someone comes within that distance, that you put your mask back on. And that's really what we've seen related to our contact tracing too. It's those opportunities when people are in close contact when they are unmasked, and that's when we're having that transmission. And so again, in your private office, you can unmask, and if someone comes in, don your mask after that circumstance.
There is another question that just popped up, Susan, since I have you here unmuted. How about, what are we doing to encourage people or to educate people? What do we do with employees that they're hesitant, they're fearful? Do we have any information? Do we have any kind of places that we can direct them to, a video of some type? Are these measures effective? Or are people who are worried, who can influence these folks, is the question.
We're trying in multiple ways to make sure that we're getting information out there. I think, lots of questions around, the vaccine having this emergency use authorization, and that really is through a rigorous review. And that really right now with the vaccines that we have available, we have more data than we really have seen for any vaccine in the past. We have the largest number of clinical trials that happen very, very quickly, but not because of rushing, just because there are so many people willing to participate in these clinical trials. And then I think the other thing is there's ongoing safety and evaluation, and we have been updated with that information periodically over the last 9 months as well. And so we're trying to make that information available through, we've done other town halls specifically around vaccine. We've done some targeted education to some areas across the campus where there has been some questions and concerns. We have created social media content. We've had some students that have taken this on to help educate their peers as well around vaccination. And then we have information on social media. We have links on our COVID-19 website for the campus that is tied to CDC's questions, tied to our frequently asked questions. And then, of course, we have vaccine availability at vaccine.uihealth.care. And that has also just frequent questions and concerns that people have to try to make that information available. So again, just really trying to make sure people are aware that we have good safety data on the vaccine, and that emergency use authorization is a rigorous review, and likely we will have full FDA approval by the end of September as well. But it's not that, that's more of a formality. The safety and rigor review happen with the emergency use review.
Okay, and one last one, Susan, I retain the right to come back to you. I think I will have, given the nature of the questions that we're receiving. Boosters. Where are we with boosters? Are we ready? Will we be able to provide boosters to our faculty, staff, students in a timely manner?
I think, you know, the great thing is what we've been able to do as a health system and as a campus. So through collaboration of the campus and the hospital, we were able to give almost close to 140,000 vaccines through multiple efforts. And the team that made that happen is poised and ready to be able to make booster vaccines available should that be approved and recommended for everyone. And so if that does get approved, which we are hearing will likely be mid to late September, that would be approved, that people would get a booster, we will make that information available and provide information on how to get vaccinated. Right now, for those that are aware, it looks like it likely will be for those that are vaccinated that it's been at least 8 months. So likely going to be our healthcare workers first, because they were the first in the tier to get vaccinated, and then will be available for others as well. Right now, for anyone that is immune compromised, there is a recommendation that you get a third dose 28 days after you've had 2 doses of an mRNA vaccine, which is Pfizer and Moderna. And we have that available currently for those that would need it.
Susan will come back to answer a couple of more questions. Let me address a couple of questions that they are my responsibility before I call on John Corona to talk about parking. One question that is critical is when do we recognize that we have a surge, we are in emergency, and we have to change the model that we have? What kind? It came in different ways from a couple of different people. What metrics do we have? A standard metric? There was a reference to NIU that they made an announcement about a standard metric in the county and so on. It is complex. First of all, we will follow immediately any guidelines either at the state or the city level or the county level. We have proven before, however, that we act before these guidelines because we're even more sensitive in terms of identifying data and trends, and also in terms of taking decisions to protect our community. And we did it. We did it in the fall of 2020, and we did it in the spring of 2020, before the city acted and before others acted. Right? The tools that we have in our hands are the surveillance testing that we will be doing, and the percentages that we will see on campus, in addition to what we see beyond campus. But by the time that we see large numbers beyond campus, it's late. We should have already acted, and we have acted before this. So we will rely mostly on our own data, what we see in terms of the saliva testing and the percentages. I heavily rely in making these decisions on our experts. Dr. Bleasdale and I talk very frequently, and the other group that we have, the contact tracing group and the public health experts. So these are the things that we will monitor very carefully to see if and when we need to pivot. But we have a significant outbreak, and at this point, it's where the risk has increased, and we're going to pivot. I know you want me to give you some specific number, probably, or very few you want to see. There is nothing like this. It has to be, all the data have to be combined and analyzed by the experts. And from the very beginning of this pandemic, the first message that I sent, even before we had no idea what we were dealing with, is that we place our trust in science. That's exactly what we have been doing. That's exactly what we will do in this case. Is it likely that this is going to happen? I don't know. Is it possible? Absolutely. It is. That's why we are always speaking about the next few weeks, when we know what the outcomes are going to be, and to continue to monitor them. That's exactly what we will continue to do throughout the semester. There was a second question also, says, why do we have to be on campus? Right? In essence, it was much longer in the way it was phrased. Because we need to support our students and because we need to continue on our mission. If your presence on campus has nothing to do, it's not necessary for the support of our mission, whether it's our students, our patients, our research efforts, then this is a discussion that should have had with your supervisor using the remote distancing, the remote working policy that we were one of the first universities to put in place back in May, and making the appropriate arrangements. If people can be effective, can continue to support our mission and being away from campus, there's no objection. That's why I put this policy there. But the fact that you are asked to be on campus, that basically means that your supervisor believes that this is critical for the support of the mission, and that's why you have to be there. This is the distinguishing factor. It's not that we're bringing people just because we want to bring people on campus. That's the last thing that anybody wants. And, you know, being more effective and more productive away from campus, if this can be documented, it's not affecting the mission of the university, by all means. That's why we established this policy, that this is up to the supervisor to make the assessment and have this discussion to figure out if this is indeed the case. John Coronado, parking. What's the story about parking is the question. And what are we implementing this fall? Is it business as usual? Are we changing and so on?
Sure. Great. So I just posted in the chat a link to our parking services website that discusses what we call the value card program. Some of you may know that we instituted this program a year ago in response to the pandemic and recognizing that fewer people will be coming to campus and many people will be coming more infrequently. And so therefore monthly parking passes may not be required. And so we extended the value card program into this academic year. We did make price adjustments so that parking for faculty and staff will be $9 a day. For students, it'll be discounted to $6 a day. And for those prior to the pandemic, these rates were, the daily rate was $15 per day. So still a reduction. And basically what it works out to, if you're coming to campus less than 11 days a month, then you should participate in the value card process rather than a monthly pass process. There are also ways to switch from a monthly pass to a value card pass and vice versa, should you need to pivot to more remote status.
Thank you, John. Let me take the opportunity also to introduce another new Vice Chancellor on campus, Dr. Sandra Harris-McRae. And I see Sandra just opened up. Sandra, one of the questions, first of all, welcome to this format. And one of the questions that I have seen is, can we have a depository of information? Can we have a central site in which all of this information is available? Can you tell us what marketing and communications is trying to do in this area?
Absolutely, Chancellor, and thank you for the welcome. I am extraordinarily excited to be back home in Chicago and to contribute to the impact and partnership with each of you. In regards to the question, we are currently updating the COVID website. The best place for information is the FAQs within that website. We are updating that website in real time. And certainly if there are other websites that should be connected to it, you will see links within that website. So there already is a central repository for all information.
Excellent. Thank you. And there are some postings, some additional information, as Dr. Harris-McKay said, in other areas that they will be linked. So that, I think that's what you were talking about in the question when you were suggesting the creation of the repository. And that's exactly what's happening. Dr. Blisdale, Susan, one question that has come up is about children, or in general, let's put it this way, not only children, but individuals that cannot be vaccinated at home, but I think it primarily refers to children under the age of 12, right? That they cannot be vaccinated. Is this an exemption for everyone that has children under this age at home?
I would say
coming to campus, basically.
Overall, no, that exemption is not necessary. Because of the measures that we have in place on campus, we have a safe work environment through our universal masking, through the regular testing of those that are unvaccinated, the periodic testing in general on the campus, and the rapid contact tracing that we have available. So overall, having a child that's not vaccinated, especially children under 12, are at lower risk for complications from the infection. It is more from the standpoint of the parents that might be at higher risk from age and other comorbidities for complications. And that's why it's been so critical for those of us that work here to be vaccinated. So no, typically having a child that's not vaccinated is not a need for an exemption. So that if there's any need for exemption, it would really be related to medical conditions and would need to be reviewed and should be escalated through the right channels to have that medical review.
And if somebody has a person, a member of the family that has medical conditions, what's the process there?
Right. So, again, overall, we provide a safe work environment, but if there is any concern of risk related to an individual or a family member that's compromised, that should be escalated through a human resource channel to the Office of Access and Equity, which then is reviewed with input from employee health as well.
Right. And from what I understand, children under 12 are going to be in school, right? You're talking basically for children under 5 that they will not be at school, or even under 4 that they will not be at school, especially in this economy.
And I think to highlight to people, vaccine is protecting against hospitalization and death, but it's the masking that we have in place that's really preventing transmission. And so that's the key part here, is making sure that you're masked when you're in the setting. If you have those at home that are vulnerable in any way, make sure that you're wearing your mask diligently in all settings in work and social life.
Thank you. There is also another question about the disciplinary process. Most of you, if not all of you, heard about it today for the first time. And the question is, are we going to broadly distribute it, and why it hasn't been broadly distributed so far? And that falls under my oversight 100%, because it's my responsibility to establish policy, and we haven't finalized the policy. This is what Mike Ginsburg mentioned is the very final draft, but we are waiting just for maybe another day as we discussed, and I discussed with the U of I system, to make sure that we're consistent, there's no inconsistencies there. I fully expect that the policy will be signed and will be released by tomorrow. And then, of course, it will be broadly distributed and disseminated, and we will post it, and it's going to be part of, in addition to sending an email out, we will post it as well, in addition to in the COVID depository site. In lack of a better term, I'm sure we'll have a better term to describe this. I don't know for my assistants here who are trying to help me with all of the questions that showed up. Is there anything that we haven't answered at this point? Any question that remains? I think in my list, I have scratched pretty much everything out. Unless I see something popping up in the chat, I assume that that we have covered everything. Anything from the PJ? Yes, I saw what you said. Yeah, there is an update for Rockford.
Yeah, I just wanted to, it's the nice thing about having people listening to this who can share information. For the regional campuses, there has been significant investment in tech upgrades. Some of them are in place, some of them are ongoing, but absolutely the answer is yes, the regional campuses have been addressed during this process.
Oh, and there is another one, and thank you, Javier. The provost brought it up to me. There is a question: what are the guidelines for faculty approaching students about checking their health pass? Since the campus guidelines state that we can ask for their health pass, and under what conditions can faculty ask? And so Karen is actually volunteering.
Yeah, volunteering.
Handle this, but I'll let you handle it, Karen.
So you can ask students to see their pass, their daily badge, if you will, and you're going to see, as TJ mentioned, that they are vaccinated and cleared, or that they're going to be testing. You'll see a saliva testing result and a daily health check result. And my advice to you is, if you see something in the red, you tell them to immediately do their health check if they haven't done it, or go get a saliva test if they haven't done it. And that will get that done. I think that's, again, you should not be asking them to tell you why they're not vaccinated or anything like that. Just get them to do the testing they need to do. I'm going to I see something in the chat, Chancellor, that
let me go to this a little bit further.
Okay.
The faculty has every right to ask for the pass, but we have to be careful. We cannot engage then in a discussion that says, so why haven't you been vaccinated? We can ask if you're vaccinated or not, and we can do this with employees as well. But to enter a discussion of why haven't you have not been vaccinated, and what are you planning to do, and so on, that's tricky. I wouldn't go down that path. We're not allowed to have this discussion with employees, period. Even engaging the students along these lines, it will be a mistake. Karen, do you want to address that?
I see another question about if students request to take an in-person class remotely, who should make this determination? I think, again, we want to emphasize this is a transition semester and acknowledge that people are still uncomfortable coming to campus. So I would encourage compassion, and I would encourage the instructors to work with the students to see if it's feasible for them to take the class remotely. And just be kind. This is an interesting semester. I don't know if anyone else wants to chime in on this, but that's my opinion.
And I would add that we want to accommodate the students to every extent possible. Remember, we are here to serve the students. They're not here to serve us. We're here to serve the students. If it is possible, yes. If it's inconvenient and possible, yes. It's not the convenience of the instructors that we worry about. But if it's impossible, then the case has to be made that this is impossible. There are other questions that they're popping up into my. Javier, you want to take the next one?
No, I just wanted to open the door that what you said, if it's inconvenient but possible, to let us know. And if there's resources we need, technology that we can work with, please let us know. We want to make sure that we serve the students to the best of our abilities and help the faculty do so as well. So.
And there is a lot that I see here about having mini vaccine information town halls. I think there is a number of them that have been done before. I don't see, is Dr. Bleasdale still with us? Yes, she is. Susan, there is the question, can we get one or two mini vaccine information town halls that we can refer people to? And I would ask in this question, are these effective? Can you influence people through a town hall?
I think sometimes they've been effective, especially when they're live, because it allows people to participate and ask questions. And I've had a lot of people ask some really valid questions. And and I think feel better when they get, affirmation of what's the truth from that standpoint. So I think it's helped some people. We've tried to target that. We've done some for students. We've done some for faculty. We've done them for different departments or divisions across the campus. We haven't, because they've been live with questions, but maybe we can revisit this again. Also maybe I know there are some frequently asked questions that we've done, and we've provided those frequently asked questions online, but maybe we need to do that again and record it and make it available so that people can be referred to it for questions. But I do think it's that kind of live in person to get people's questions addressed whenever possible. So if those across the campus have a particular unit or area where they feel like people have questions, we are happy to go and provide either on site in some version or some virtual question and answer to address concerns.
Thank you. And there is a last question that I see again that was sent to me. How, and this has to do with Mike Ginsburg in terms of the reminders and interdisciplinary action specifically refers to AP employees, but maybe beyond the AP employees, before issuing a notice of non-reappointment in the case of the AP employees. And is there a template letter for this reminder? I know the answer to this is no at this point because we're preparing for it, but I assume there will be within the next few days.
And yeah, we'll prepare a template letter that other people can use. I think that's probably a really good idea. And as far as my advice would be, and I think we mentioned that 2 reminders is probably sufficient. And what I would encourage supervisors to do is, as you're issuing those reminders, to indicate to people that they can be disciplined up to and including a notice of non-reappointment. Certainly, that's not the goal here, is to fire employees. The goal is to get people vaccinated, and anything we can do to continue to remind people to meet the requirement will be the preferred option.
And let me reiterate this, the last statement that Michael made. We're not punitive. We are not trying to punish people because they get vaccinated. They don't get vaccinated. Quite frankly, I would take it one step further. Our goal is not to get people vaccinated. Our goal is to protect the safety and the health of our academic community. And vaccination is a key factor, the most central factor in this effort. That's why we are going down this path. And that's why we agree with the University of Illinois system when they establish the required vaccination policy for both faculty and students. That's what we're implementing right now. And I would suggest that, and we have tried through this policy to be as persuasive as we can be, but there is a point that in order to protect the health and safety of the community, you have to take some disciplinary measures. That's the path that we're following. Well, thank you, everyone, for participating. Please pay attention to the messages that we are sending out. Sometimes I worry that we send a mass email and nobody reads it, and we have the Q&A and we have the information that comes through through marketing and communication, also with the daily news information and so on. Please follow and disseminate within your own colleges, departments. Don't expect that. My experience as a dean, as a department chair, is that my messages at that level were read by the people in my department or my college more than they were reading the president's messages at the University of South Carolina or the provost's messages. So please help us spread the word and make sure that the people in each one of their units are informed of the measures that we are taking, the expectations of them, and the processes that we are putting in place. We'll try to communicate as quickly and as frequently as it is possible because we rely on you in order to be able to implement all of these measures that we are taking. And again, please understand that we are trying to predict the unpredictable to a large extent, and we have to be flexible during this process. I want to thank you one more time for everything that you do to keep the university going. And I'm sure we will see each other again soon, maybe in this format, maybe more in person. Wish you the best semester that we can have during this transition period. Thank you.